Hello, this is Dr. Ankan Pathak, consultant physician and working in College of Medicine and J&M Hospital in Kalyani in the outskirts of Calcutta. So we are here to discuss on hypertension and what it actually means to deal with hypertension on a day-to-day basis, and what are the precautions to prevent hypertension in the longer run, and what do we doctors do to treat hypertension for our patients. Now, as the word suggests, hypertension is basically a term which is coined for elevated blood pressure. When we talk of hypertension and its definition, each time a heart contracts, there is formation or fast flowing of blood through the arteries, which creates a pressure over the blood vessels, which is basically defined as hypertension. Now, hypertension is just defined as elevated blood pressure levels. Normally, the blood pressure levels in a healthy individual, depending upon the age, sex and race of an individual, is around 120 by 80 millimeters of mercury. When the pressure or the blood pressure, both the systolic and the diastolic blood pressures, are elevated over a period of time for a prolonged duration, we stamp these patients as having hypertension. Now, just to go into the details of what hypertension is and what the two readings are, namely the systolic blood pressure and the diastolic blood pressure. The systolic blood pressure is basically the pressure that we actually calculate or find when the heart is contracting, whereas diastolic blood pressure is the blood pressure which is found when the heart rests in between the two beats. Blood pressure is actually found or actually done or using a simple sphygmomanometer. When we talk of the risk factors of hypertension, they are either modifiable or non-modifiable. Non-modifiable are the age, the race, the family history of hypertension, whereas modifiable are obesity, history of smoking and other over-the-counter drugs, and stress. Regarding treatment of hypertension, the first and the foremost and the most important is lifestyle modification, which is basically number one, to actually go for aerobic exercises, which is basically walking for 30 minutes a day on most days of the week. Follow a DASH regimen, that is dietary approaches to stop hypertension, which includes lots of fibers, good fats and whole wheat grains. Cutting down on alcohol intake, stop smoking, cutting down on the amount of drugs or the over-the-counter drugs like steroids or NSAIDs like painkillers are very commonly found in our day-to-day practice. And also, now the last is to reduce stress. We have multiple medications right now as far as hypertension is concerned. We are not going into the details, but there are drugs which help in protecting the kidneys. There are drugs which promote natriuresis. And as a result, we now have a whole host of drugs that help us in treating hypertension. Thank you.